We all are aware of vaccination for children. There is a childhood vaccination schedule for kids, but unfortunately, we don't have such a schedule for adult vaccination. In guidelines, there are very strict criteria and very clearly defined criteria for adult vaccination, who will be vaccinated, who will not be vaccinated. There are at least 15 to 20 vaccines in the adult vaccination schedule. So most commonly it includes the influenza vaccines, pneumonia vaccines. There are two types of pneumonia vaccines. Then we have vaccines for MMR, mumps, measles and rubella, DPT, diphtheria, typhoid and pertussis. Then we have vaccinations for varicella, chickenpox, and also as well as herpes zoster. We have vaccines for certain population for coverage of hepatitis A, hepatitis B. We have vaccines against meningococcal diseases and in H influenza B. For females, we have a HPV vaccine, and there are a few more vaccines which is indicated for a certain group of patients. As we age, with biological aging, our immune system also ages. So there is immune dysregulation, means a person's ability to mount a response to a bacteria or a virus is much less as the person ages. So hence the need for adult vaccination. It has been said that after 65 years of age, every 10 years the immunity of a person goes down significantly. And that is the reason we have adult vaccine as well, booster of the certain childhood vaccines to augment the immunity of a person. These vaccines are for elderly people. This is for the adult population, and each and every person with the age more than 65 years are eligible for these vaccines. Coming to the second part, yes, the patients with comorbidities, they can also take vaccine. In fact, they are the target group for these vaccines because they generally have a low immunity, and vaccines help them fight the disease better. So for even the age criteria is lesser for people who have comorbidities like diabetes, heart diseases, lung diseases, chronic kidney diseases, and patients who are on chemotherapy, and the transplant patients. All these people are the vulnerable group who should be vaccinated. These vaccines are very safe. If side effects are concerned, it's very mild in very few people. It's generally a sore throat or a feeling of body pains or a mild fever, which is self-limiting, does not require any kind of treatment, or at most a paracetamol should help. And all of these vaccines are very safe. Very rarely, some of the people can have allergic reaction, but generally after administering vaccine, we observe the patient for a certain duration of time to identify any allergic reaction, and which can be managed in the hospital itself.